mean, for example, a cousin of mine, he had cancer, so he knew immediately what he wanted to do was his wife to freeze her eggs and things like that for the future. Um, at that point, obviously, that's a different circumstance for someone because they were told, we advise, or if it's up to you. But is there any kind of like health implications from the baby, being produced from a frozen egg versus a kind of, like you were just mentioning before, or is it you can't? I don't know.
So there are babies born now with frozen eggs. Obviously, when the eggs are frozen, you have to inject them with the sperm, that is ICSI, not plain IVF that you have to do. There are they have currently similar risks as the IVF pregnancies.
Right.
And the conditions you've described is called fertility preservation, where we do it for medical reasons. So the good thing about freezing eggs is the technology is very good, which means that we are able to preserve fertility for those who are going to lose their fertility because of cancer, because of drugs, for medical conditions such as sometimes for rheumatoid arthritis, which is affecting their quality of life, and they have to take medication. So that is completely different, and for that, services available almost everywhere in UK. So those cases, yes, fertility preservation is done, and we freeze the eggs, we freeze the sperm, we freeze the embryos, whatever obviously situation is. However, not doing it for just because we made it as an insurance, I don't think we are there yet, and we should be currently promoting that at all. No.
Okay, no, that's fair enough. Thank you for highlighting that importance as well. Because you're right, we can't be going into procedures like that. And like you said, there's a psychological impact on that too, which is really important. When you mentioned that, I said, well, yeah, of course, if anyone wants to go through it, of course, it's quite a big thing, isn't it? But yeah, so going back to kind of conceiving and trying to get pregnant, we've got quite a few questions on that. So, for example, my mum, she gives me kind of these old wives' tales of having small grapes and getting pregnant, and I don't know, all sorts of things. And I can tell by your face that that's probably a myth. I was going to ask, is there any truth in it? Which obviously there's not. But can you give us any real tips on how to improve our fertility from women? Obviously, losing weight was one of them, stopping smoking. Is there anything else we can do?
Yeah, I mean, everybody need to be aware, obviously, about impact on age. So whenever you can have pregnancies, obviously, you have to have the right man, you have to have the right circumstances to have that. And if you're not getting pregnant, go to your local doctor early enough. If there's an issue, stress does play an important role.
Right.
Stress affects fertility because stress affects hormones. It's all mind-body thing. It's easier said than done. We are living in very stressful circumstances and stressful life nowadays. So that is one factor. Regular sexual intercourse, don't just wait for that day of ovulation, because that puts too much psychological pressure on you, and that affects your relationship as well. So sex 2 to 3 times a week does cover most of the time, and the timing of ovulation, even if it's slightly irregular. So that's what I advise my patients.
Okay, fine. I mean, we get a lot of people who call us on our helpline, on the Muslim Women's Network helpline, new couples who are being pressured, into having babies quite early on. So, I mean, a lot of that, I guess, is stressful, which could probably put into part of them trying, but they're stressed about it and then it's not happening. So I guess that's one of the things that maybe if we had less pressure on ourselves, it would happen easier, maybe. Am I
Yeah,
right?
you're absolutely right. I mean, the pressure is from day one. Now, not everybody conceives within first month. There's a reason why NICE has said 12 months of waiting for young couples who have no other problems that I've highlighted before. Because the normal chances of conception every month is about 30%. So not everybody will conceive within first month. So give it some time. and things will happen. And most of the time, so 80 to 85% of the couples conceive within first year, another 10-15% within next year. So we used to say previously we shouldn't investigate before 2 years. However, we have said now we investigate after 1 year. I mean, this morning only from the clinic, somebody who was coming to our clinic for waiting for IVF or and just investigations was found on ultrasound to be pregnant. People do conceive on their own. If you just take your mind away, sometimes it works because that stress is not there. A number of people conceive waiting list, yeah.
Wow. Okay, fine. Does contraception affect fertility? So, I mean, I've had a few people who told me not to take the contraceptive pill because it will delay me getting pregnant. Is that true?
Not that I'm aware of, no. The only contraception that can cause slightly delay in return of fertility is the injection depomedroxyprogesterone acetate that you take once every 10 to 12 weeks. Other than that, everywhere else, what we advise people is you can take contraception as soon as the contraception is over or once you are off it. It's almost immediate return to fertility. Yeah.
Okay, fine. And we were getting on to kind of talking about IVF earlier, about our kind of options if we can't conceive naturally. Obviously, after 12 months, if we've had an issue for 12 months, we'll go to obviously the GP, talk about this, get referred to someone. You know, IVF, tell us kind of how it works. You know, how, I mean, you've told us about statistics before, and on average, how quick does it take on IVF to get pregnant?
So yes, so if you come to your GP, they'll do some blood tests and other tests and then refer you. And every place is different; they have different pathways. So the whole point of investigations and investigating and asking you lots of questions would be to find out what are the causes, if we can identify any. So I'm going a step before IVF, if that's okay. Is to find out whether there is a problem with eggs, whether there is a problem with sperm, whether there's a problems with the tubes where sperm and egg meets, or if there isn't any problem, you know. So IVF is only indicated when there is either no problem and you've at least tried for 2 years, or if there is a problem with tubes, or if there is a problem with sperm. If there is a problem with eggs, then most of the time you can have simpler treatments, such as tablets or injections, without needing to go through the full saga of IVF. If you need IVF, then your doctor will be able to advise you based on various things. We do take in consideration how long you've been trying, how old you are, and all other bloods and everything else. So if IVF was decided, then and it's important to remember that not everybody will need IVF. If IVF was decided, then the way it works is that we give women injections to produce multiple eggs, even if she's producing eggs, because what we do in IVF, we try to get multiple eggs so that we can create multiple embryos, which is egg and sperm mixed together, so that we can choose the best one, so that we can select the best one, put it back in the womb. So putting lots of chances together in one treatment.
Okay.
So the process, as I mentioned before, is quite long and invasive, because when we are getting your injections, most of the time you're injecting yourself. They're simple injections, but we teach you how to do it. They're everyday injections. You have to be monitored when you're having injections. So you'll require transvaginal scan, at least 3 to 4 ultrasound scans. Some people do blood tests as well. So repeated clinic visits are needed. Once your eggs are ready, you then get the booster injections, and we then do a surgical procedure of egg collection, which we inject a needle inside your vagina and under ultrasound guidance collect the eggs. Those eggs are collected, then given to lab team, and they very sophisticated labs where they'll mix egg and sperm together. The embryos grows inside the lab for 3 to 5 days. We select then the best one and put it back into the womb. So that process does take at least 3-4 weeks, if not more, sometimes longer, depending upon what medication we are giving you.
Right. Okay. Well, it sounds quite stressful as well, having to go through all that, and quite painful. I can imagine if is it quite a painful procedure?
I mean, those injections are like insulin injections. So I mean, every injection or every needle is a bit painful, but that is why I was saying that everybody doesn't need IVF. Those who need IVF, obviously, we are very careful in recommending those who need IVF. Although people think IVF is the kind of there to sort out everything, but it does put a lot of psychological stress. And I have seen couples separating during the process of IVF because of the stress it creates to you. We do provide a lot of support during, I mean, most of our IVF team are across the country. Every IVF team has independent counselors. The nursing team are very, very good in supporting you in going through these treatments, because we all realize how difficult it is for you to reach this journey, and we can't give you 100% success rate despite putting egg and sperm.
Yeah, exactly. Yeah. I mean, that was going on to my next question, actually. I mean, how many attempts on average does it take to kind of get pregnant or conceive with IVF on average for an average healthy kind of couple?
Normally, we say 2 to 3 attempts gives you quite high success rate, but again, with every attempt, you get eggs collected, if you get lots of embryos created, then we select the best one. Rest, all of them could be frozen, so you don't have to go through injections and everything, because those embryos could be thawed and transferred. They are much simpler process. So it all depends on how many embryos you got, what the quality is, as to how many attempts each one get, and what is the funding status within your area, because throughout England, it is very, very different with every PCT that you've got postcode lottery there. We are very lucky in Scotland. It is one, and everybody gets 2 cycles, so that whosoever needed, So we are a bit more lucky there.
That's the thing. I mean, it's quite, like you said, there's a certain amount of attempts until it can be successful, and then you only have a set amount of attempts on the NHS in certain areas. That's quite, I mean, one woman in one area will not get the same chance of getting pregnant as another woman in another area. It sounds really unfair, but it's nice to know that there are things that women can do to kind of improve their chances in terms of working on their health and not just women, men as well, as we've just highlighted as well.
Absolutely.
Yeah. Okay.
They support each other. That is very, very important. And remember, fertility clinics are for both. So we do provide counseling for men as well, because as you say, they are forgotten most of the time in fertility journey, because the consenting women, they are both equally important.
Right. Okay. Now, I was reading this article. It was in the New Scientist. It's a New Scientist publication, and it was talking about how women in the future can, well, at the moment, obviously, to test their fertility, how many eggs they have, they'll need to go to the GP and get a test. But in the future, they can get like a hair strand test or something like that. Have you heard of this? Is this?
Yes, there is a lot of research going on. Okay, so well, where we want to be is to tell a girl who is born just now that what is her ideal time for having the baby would be, or after which she'll have trouble. Unfortunately, that crystal ball doesn't exist. We all are looking for it, but it doesn't exist. Blood tests as well only tells you what is the situation today and what medication and how much dose do we have to give you for IVF. They don't tell you anything more than that. They do not tell you how long you have left. It absolutely doesn't. And that is one of the myths people have, that we'll do this blood test and that will tell us how fertile we are. Unfortunately, it doesn't.
Okay. But with regard to this hair strand test, is that something that is like on the kind of books? I mean, I don't know. I just
lot of research going on various things, so it is under research right now. So for research purposes, yes, it is fine, not for clinical use yet.
Okay.